What does a radiologist see in a barium swallow for reflux? Imagine watching a moving picture of your esophagus and stomach, but instead of a movie, it's a real-time X-ray. That's what a barium swallow study offers. When doctors want to understand acid reflux and gastroesophageal reflux disease, they often turn to this test. It helps them see what's happening inside your upper digestive system. During the test, you swallow a chalky liquid that contains barium. Barium is a special substance that coats the lining of your esophagus and stomach, making them visible on X-ray images. As you swallow, the radiologist watches how the barium moves through your digestive tract. They look for signs that stomach contents are flowing backward into the esophagus, which is a key feature of reflux. One of the main things a radiologist looks for is barium reflux. They observe whether the barium moves upward from the stomach into the esophagus. Sometimes this happens spontaneously, and sometimes it's triggered by actions like coughing, changing your body position, or doing the Valsalva maneuver, which is holding your breath and bearing down. If the barium moves back up, it suggests that the lower esophageal sphincter, the valve that keeps stomach contents from rising, isn't working properly. The radiologist also checks for hiatal hernias. This is when part of your stomach pushes above the diaphragm into your chest cavity. On the X-ray, this appears as gastric folds or mucosal rings above the diaphragm. A hiatal hernia often makes reflux worse because it weakens the barrier that keeps stomach acid in place. They also look for changes in the esophageal lining. If you have reflux esophagitis, the lining may look irregular or granular. In more severe cases, the images can show ulcerations, erosions, or thickened folds. Sometimes, the damage causes the esophagus to develop scar tissue, which can lead to puckering or even shortening of the esophagus. These structural changes might appear as a step-ladder pattern on the images. The radiologist assesses how well your esophagus moves the barium downward. If the esophagus is slow or weak, it can cause more reflux and worsen symptoms. This part of the test helps understand if motility issues are contributing to your reflux. While a barium swallow gives a good look at the anatomy and some function of your upper digestive system, it's not perfect for measuring acid exposure. For that, doctors often use pH monitoring tests. Still, this test is a helpful first step to spot structural problems like hiatal hernias or damage to the esophageal lining. In short, a radiologist looks for signs of barium reflux, anatomical defects like hiatal hernias, mucosal damage, and how well your esophagus moves. These findings help doctors diagnose gastroesophageal reflux disease and decide on the best treatment plan.